Okay, hi everybody. We are going to go ahead and get started. I want to welcome everybody to this third meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments. So here's what we plan to do today. After a quick introduction and project recap, we're going to dive into our main task today, which is a focus on the dementia care workforce. We will be joined by Andrew Ross, Director of State Affairs at Alzheimer's Association and Alzheimer's Impact Movement. And also Diane Tai, Senior Director at the Center for the Future of Aging at the Milken Institute. We will turn to your questions and comments after their remarks, and I'll tell you what I know so far about our next network meeting, and we will wrap things up for today. I know we have quite a few newcomers joining us today, in addition to lots of folks who have become regulars. When I checked the other day, we had folks from 29 states and DC registered to attend. So just a quick reminder of what our current project is all about. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide. One of the 3 focus areas that we had for the project last year was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. That focus area is now the jumping off point for this new project for 2023. We are pleased to again be working with the Commonwealth Fund to build on the work that we did last year. This project includes using the model for last year's 8-state task force to create a national long-term care workforce network, which you are all now a part of just by attending this meeting and choosing to engage with us on these issues. We're working on building a new website, a national online resource center that we hope will become a clearinghouse for all the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website. And please feel free to make extensive use of the chat and Q&A functions here on Zoom to share relevant legislation, policy reports, and other materials that we can post to the website. And please feel free, to share links with us in the Zoom chat and the Q&A as well. Also, tell us about who you are. Try to connect with other attendees working on these same issues, and of course, submit questions for our presenters today. The new website will also be a digital visualization and extension of the policy guide, where you'll be able to click on one of the state strategies on long-term care workforce needs from the policy guide. Let's say it's increasing compensation and employment supports or improving data collection, and see what states are doing in those areas. That is coming soon. We also, with this project, have the opportunity to provide technical assistance services for up to 5 states. If you believe policymakers in your state could benefit from a detailed briefing on how they might take action to address long-term care workforce needs, please get in touch. So I have known for some time that one of the issues that we really wanted to drill down on as part of this project is the dementia care workforce. As you will hear from Andrew Ross today, data shows that 49% of nursing home residents have Alzheimer's or other dementias. My 83-year-old parents are among them. That number is lower for other types of facilities, but 49% for nursing homes. We also know that there are insufficient numbers of dementia care specialists, and that the direct care workforce, the largest segment of the workforce that supports people living with dementia, is seeing extraordinarily high turnover rates and recruitment and retention challenges. Today, we're going to hear more about who that dementia care workforce is, the challenges they face, and efforts to build capacity within the dementia workforce. I want to introduce Andrew Ross. He serves as Director of State Affairs for the Alzheimer's Association and Alzheimer's Impact Movement. In this role, he helps lead state government affairs efforts across the country to enact policies that support the over 6 million Americans living with Alzheimer's and their family caregivers. Before joining the Alzheimer's Association, Andrew worked in Maryland state government, serving as chief of staff in the state's Department of Aging, where he oversaw state and federal programs, policy development, and fiscal administration. Andrew's going to talk about the needs across dementia care, some things that states can do to address those needs, and some recent state policy successes in building and growing a dementia-capable workforce of adequately trained professionals. Andrew, the floor is yours.
All right, well, thank you, Sean. Hello, everyone. I'm Andrew Ross from the Alzheimer's Association and glad to be with everyone today. I want to dig right in on the long-term care workforce, as this group's been talking about for a while now, looking at it, though, from the dementia angle. So first of all and foremost, these slides will be available afterwards. So I'm going to go through some of the background rather quickly in order to get towards the state issues and opportunities within them. Next slide. So first, just to make sure that we're all on the same page, dementia is the umbrella term for loss of memory, language, and other thinking abilities that interferes with daily life. Alzheimer's is the most common cause of dementia. It accounts for about 60 to 80% of all cases. Alzheimer's disease is progressive. It may start off with mild memory loss, and it ultimately progresses to an inability to communicate and engage. Next slide. So today, more than 6 million Americans are living with Alzheimer's, and that figure is expected to rise to nearly 13 million by 2050. Next slide. And we know that age is the greatest risk factor. 1/3 of all older adults die of Alzheimer's or another form of dementia. Next slide. Yet this disease is made harder than it already is emotionally, since it's so difficult to access dementia care. Over half of primary care doctors believe there are not enough dementia care specialists in their area to meet demand. Next slide. Sean alluded to this, but neurologists and geriatricians, who are the most knowledgeable in this area, are in short supply in every state. 20 states have been deemed dementia neurology deserts, and 12 states would need a 5-fold increase by 2050 in the number of geriatricians in order to care for the growing Alzheimer's population. And this shortage has real impacts, right? It means that families who are struggling longer without a diagnosis, without access to new and upcoming treatments, and without an opportunity to actively plan for their care needs. Next slide. Sean also alluded to the impact in long-term care and in nursing homes. Nearly half of nursing home residents have a form of dementia, and about 1/3 of individuals receiving home health or other residential care like assisted living have some form of dementia. When hitting 80 years old, people with Alzheimer's are close to 20 times more likely to be in a nursing home than those without this disease. So you can see dementia really does have an outsized impact in long-term care. Next slide. And to no surprise to this audience of policymakers, Alzheimer's has a huge impact on the economy as a whole and state budgets in particular. In 2023, an estimated $65 billion in Medicaid spending alone will be going towards dementia care. Next slide. And states are spending 22 times more in Medicaid for dually eligible older adults with dementia than those without it. So, and on the right, we can see the state by state numbers on Medicaid spending for older adults with dementia in 2020 and estimates for 2025. Again, these slides will be made available afterwards, so no need to worry if you can't see it right now. And regardless of your state, these numbers are huge. They range from 75 million or so for Alaska to in the billions for some states. Next slide. And this disease crossed the state agency lines, right? We can't necessarily silo it into one state agency. So in order to make progress towards improving the state's response to dementia, it really does require multiple agencies to be engaged and collaborating with each other, since there's so often a lot of overlap. Next slide. And by and large, states are beginning to recognize the wider reach of dementia in state government, with most publishing an Alzheimer's state plan that details how the state government will lead on this issue. So this map looks at the year of the most recently published Alzheimer's state plan per state. Prior to 2015, those states that are not colored purple, the plans were often more visionary and less actionable. And I should also note that since this map was published last year, states like Colorado, North Dakota, Louisiana, and Vermont have all recently issued updated state plans as well, which is very, very exciting. Next slide. And these plans, it's important to note, come together with leadership from state officials and from external stakeholders like long-term care providers, clinicians, advocates, caregivers, and people living with the disease to share their own experience. And the plans ultimately serve as a playbook for policy actions that the state will be able to take in the coming years, and it's something that can survive changes in political administrations. Next slide. But in order to see the plans actually be implemented, more states have recognized that they need dedicated resources for it. So more states are establishing permanent full-time positions that are solely focused on dementia. You can see here, those states that already have the position in purple, those that are pursuing it in gold, and then those that have actually secured just this year in teal. Next slide. These dementia services coordinators work across state agencies and with other stakeholders to implement their state plan and to really understand what's working well and where gaps exist, right? They're routinely seeking and securing federal funds towards elevating this work and are collaborating with their peers in other states to avoid rebuilding the wheel because so many states are struggling with similar issues. And I should note that, unfortunately, we've heard from a number of states that the state agency says, we like to prioritize Alzheimer's, and we know there are federal funds out there, but we don't have the resources even to apply, which is really a missed opportunity. Next slide. So in addition to ensuring that your state has an active state plan and is establishing a dementia coordinator position, state governments really are grappling with huge dementia care workforce shortages, which were alluded to earlier. And this applies at all levels, right? From physician specialists to direct care workers. So what can states do here? I've listed a few policy actions here, right? Looking towards establishing advanced opportunities for direct care workers through career pathways, looking at how we can ensure dementia care professionals are included in loan forgiveness programs, for example, all towards increasing the numbers and retention as well for these positions. Next slide. So I want to give some examples. Colorado enacted legislation adding geriatrics to the list of eligible specialties for physician assistants and advanced practice nurses to access loan repayment and in return for working in underserved communities for 2 years. Georgia added certified nursing assistant or CNA training to their list of free tuition programs because they recognize those huge workforce shortages and the urgency of those positions. Next slide. During the height of the pandemic, we saw a lot of states were very, very concerned about the very viability of the long-term care system as a whole. Michigan issued an executive order looking at the nursing home workforce. And then more recently, Washington State approved over $3 million for career pathway programs for CNAs to advance in the field of nursing, and also to develop virtual CNA trainings to reach more potential prospective CNAs. Next slide. So stepping back, we also know that Alzheimer's is underdiagnosed, which impedes access to the new treatments that are coming online and limits care planning. The physician workforce shortages certainly contribute to this, but doctors are also reporting difficulty in diagnosing. So what can states do here? Look at training standards for physicians. Public health agencies also are sending out communications and education aimed directly to providers, and they can focus on the early warning signs and benefits, early detection and diagnosis. Next slide. Just to highlight a couple examples here, Illinois and Delaware have each enacted legislation requiring physicians and nurses to complete an hour of dementia training for healthcare professionals. These have only been enacted recently and are still being implemented, but they can have significant implications in patient care and helping families dealing with this disease. Next slide. So within long-term care specifically, we know that a significant proportion of care recipients have some form of dementia, but many staff are ill-equipped to effectively care for them. Just having a baseline understanding of Alzheimer's around dementia-related behaviors, for example, around communication strategies, can make significant improvements in the quality of care, and then logically help with staff retention because they know how to better support those residents. But you might not know the federal requirements to become a CNA are about 75 hours of training with dementia among a list of 40 different topics that must be covered. So what can states do here? Look towards establishing minimum dementia training standards on its own, right? Often 6 to 8 hours, and then to identify what agency will monitor the effectiveness and individual compliance of those requirements. Next slide. And we have seen states across the country, regardless of geography, of political affiliation, whatever, adopt dementia training standards for direct care workers, some based on the setting where their care is delivered, and others for the profession as a whole. So recently, Arkansas this session enacted legislation for dementia training for staff in assisted living. They also approved dementia training for home care workers, even though it's not listed here. Georgia approved really monumental memory care licensing legislation a couple of years back to ensure that there's dementia training in place for all staff who are caring for residents with dementia. Next slide. Kentucky approved training standards for home health and personal care staff in 2021, and then the following year built on that for direct care workers in dementia care units and assisted living facilities. Maryland also approved dementia training requirements for home care workers and approved legislation to create a memory care framework with training standards. And New Hampshire established a minimum dementia training standard for all direct care workers and long-term care staff. And I think it's important to recognize that these are just a sampling of what states have done in recent years, right? We've seen success across the country, as I mentioned earlier. New Mexico also comes to mind as a state where we've seen some progress in recent years, and many more are pushing bills in their legislative sessions right now. And it's also important to note that you've heard me mention memory care a lot. Memory care is usually connected with assisted living. Assisted living really is primarily within state regulatory authority. So the states have lots of opportunity to really define what that looks like and to make sure that those residents, those vulnerable residents with dementia in those units are being cared for by staff with dementia training. So next slide. I also want to quickly highlight some other approaches that states have taken. A number of states have established state-funded dementia-specific respite care programs that provide family caregivers with a break for themselves for a couple hours a month or so in order to address their own needs, and sometimes even help them to be able to stay in the workforce. Missouri established a Medicaid structured family caregiving program through a 1915C waiver. Some of your states might also have this program. Missouri's, though, is dementia-specific, allowing people with dementia to remain at home and to choose their caregiver, which might even be able to include a family member. And a number of states have built on a Medicare billing code to allow reimbursement through Medicaid for physicians providing assessment and care planning people with cognitive concerns. Even though, as I said earlier, age is the greatest risk factor for dementia, for Alzheimer's, we know that there are a number of people who receive, who develop symptoms prior to 65, before they're on Medicare. If they're on Medicaid, this service that a physician could be reimbursed for would help them as the disease progresses. Next slide. So to wrap up, the states really do have a lot of opportunity, right? We've seen it in all the different examples and many, many more that I wasn't able to list just today. But it's really important to have a coordinated and up-to-date strategy through a recently published state plan that they can actually implement, right? Looking at workforce shortages and emphasizing training can improve care of people with dementia and a system that serve them, and also really is able to improve retention as well, which is so critical in this sector. Next slide. The Alzheimer's Association has public policy staff in every state. You may already know your state's contact, but if not, reach out to me and I'm happy to connect you. We also maintain individual state websites that highlight the status of the current state plan in your state and share current policy efforts that are being pursued in the state as well. And then lastly, everyone knows someone who's dealing with this disease, unfortunately. The Alzheimer's Association is here all day, every day, for people facing Alzheimer's and other dementia through our free 24/7 helpline that's on the screen and on our website. So thank you all, and I will turn it back to Sean.
Andrew, thank you so much. And we are going to hold our questions until the second half of the meeting. But please get your questions ready for Andrew, and you can go ahead and type them into the chat if you wish, or into the Q&A function here on Zoom. I am going to stop sharing my screen so that Diane Tai can get her slides in there. We are pleased to welcome Diane Tai. She is the Senior Director of the Milken Institute Center for the Future of Aging and leads its Alliance to Improve Dementia Care. She is also a Senior Advisor at Georgetown University's Business for Impact at the McDonough School of Business. In recent years, Diane and her team at Milken have produced reports on how care navigation can help build the dementia workforce, the projected prevalence and cost of dementia, the roadmap for investment in dementia care, et cetera. Diane, thank you so much for joining us today, and please take it away. Diane, you need to take yourself off mute there, I think.
That would help. Sorry about that. Okay. All right. You see my big slides?
Yep, they're not full screen though. You need to, I think, hit the slideshow thing at the top, or
Okay, how
there.
about now?
That's the presenter view.
Okay,
If that's what you want to use, that's fine.
how's that?
That's great. That's full screen.
You're seeing full screen. Excellent. Okay, great. So thank you for that kind introduction, Sean. I'm going to jump right in. I'm just going to give a bit of background on Milken Institute. It's probably not as familiar as the Alzheimer's Association. We're a nonprofit, nonpartisan think tank. We are focused on helping people build meaningful lives. 7 offices around the globe. I'm actually in the DC office. Our headquarters is in Santa Monica, California. We've been around for over 20 years, and we have 7 centers that lead our programmatic work, including the Center for the Future of Aging, which is what I'm part of. We have 3 pillars: MI Health, MI Finance, and MI Strategic Philanthropy. And our Center for the Future of Aging is the only center that really crosses over our health and finance pillar. And I roll up into the health pillar. And what we do is we elevate awareness, advance solutions, and catalyze action to promote healthy longevity and financial wellness. What we do is really scream from the mountaintops the impact of our aging population across all societal structures. We're known for our convenings that are cross-sector, cross-discipline, to address the realities and opportunities of aging. And we're a neutral convener. So we see our role as bringing the relevant voices to the table who typically may not work together. And we look to push for faster adoption of evidence, best practices, and innovation. And one of our key signature programs is our Alliance to Improve Dementia Care, of which the Alzheimer's Association, among many others, are a member. We're almost 3 years old. We have over 100 leading organizations and thought leaders around these key 8 stakeholder groups. And the way we define the dementia care journey is starting with earlier detection and diagnosis, all the way to care planning and delivery to end of life, and all those care transitions in between. And we have 3 focus areas: addressing health and economic equity, building workforce and system capacity, and scaling comprehensive dementia care models. So I'm really, for the purpose of today, I'll be digging into that middle one on workforce capacity building. These are just some examples of our reports that we've done that that Sean already mentioned. And I'm going to be focusing on this most recent one, Guiding the Care Journey, Building Dementia Workforce and System Capacity Through Care Navigation. The work is all intertwined. And so you'll also see, I'm pulling from another report that we did on building workforce capacity for improving earlier detection and diagnosis. So with the building workforce capacity piece, let me just jump in here. Andrew gave a really great overview on sort of the daunting statistics regarding Alzheimer's disease, the huge cost of the economy, the shortage of a dementia-capable workforce up and down the chain, from direct care workers to dementia care specialists, the neurologists, geriatricians, geriatric psychiatrists, and neuropsychologists. You'll see in a later slide, there is some confusion on this dementia care specialist title. But anyway, for the purpose of how we were looking at how do we build workforce capacity, we looked at this care pyramid, taking a population health approach to dementia care. The top tier, the 1% to 2%, 5% that fall in this area, needing the most, high needs, to the bottom of the pyramid, people more recently diagnosed with mild cognitive impairment or early stage dementia, and really trying to look at how we match the workforce to these needs, both on the patient side and all the different types of care plan items that are part of that care delivery. Just a minute on processes. These workforce challenges can be really overwhelming and complex as you look at it from a population health care pyramid. So we needed to focus instead of risking boiling the ocean here. So we recruited an expert working group, including people from the Alzheimer's Association, Alzheimer's LA, Administration for Community Living, family caregivers, CMS. We had leading dementia care experts from UCLA, Emory University, Kaiser Permanente, many, many more. And so we organized that working group, and then we interviewed over 40 key opinion leaders on, what are those constraints and opportunities. And I flashed this slide up really to show you the range of workforce types and care settings that deal with dementia care, and huge range of roles. And through this interview process, desktop research, we really honed in on the care navigator role. And I'm just going to show you this, the workforce type. So we said, breaking that framework down into workforce type, the care setting, and then the care needs. And we really looked at this care navigation role. So if you think about workforce type, really this importance of the care navigator who sits at the intersection of healthcare providers and social services providers in this role, often that single point of contact for the person living with dementia and their family. And they're also very familiar with the community-based services that are available. Care setting, we looked at adult day services or adult day centers, really who fall into two types, medical models and social care models, and also the types of training that's needed for the workers in that adult day services area. And of course, we also include the caregiver as part of the workforce. They're a vital member of any team-based interprofessional care team, and they have also care needs. So that's kind of the strategic framework that really informed our work for the care navigation report, which I'll get into. So we had our roundtable last September. We released this report in March, and right now we're going through this process that includes today of amplifying our recommendations and sharing what we learned through this consensus-based approach, working with all these experts. Why we homed in on dementia care navigation, if you look at the value proposition, we know that care navigation improves the quality of life and care for both individuals with dementia and their caregivers. It promotes person-centered care by reflecting the individual's needs and preferences, effectively coordinates medical and social care services. That's really an important differentiator. And in turn, it results in reduced healthcare utilization, whether that be reduction in emergency department visits or hospital readmissions. So this for us is a really critical part of building the dementia care or dementia capable workforce. So one of the things that we did, we really needed to define the care navigation role. There's so many definitions out there. You'll also see there's a number of titles that refer to this role. So as part of our expert roundtable, we actually took a stab at coming up with this consensus-based definition of what care navigation is. To the right of the screen are 8 core elements of dementia care, what really constitutes comprehensive dementia care, evidence-based. If you look at that number, the one there, coordination of care, we looked at this as saying, if you have a care navigator, many of these other 7 core elements of comprehensive dementia care can begin to fall into place. For example, caregiver support, so essential in comprehensive dementia care. And part of that care navigation role is providing a caregiver with support, training, access to respite care, et cetera. So again, just emphasizing how we homed in on this care navigator as a game-changing type of workforce element to improve dementia care. On this slide, I'm showing the different names. So whether you have a telephonic or online care setting, a home or community-based setting, or a clinical setting, these are all the names that refer to the dementia care navigator. And so Andrew's slides talked about dementia care specialists, and we see that more in that clinical setting, but we've seen initiatives where states are funding the dementia care specialists for home and community-based settings. So we just wanted to capture that in our report. Another section in our report, we looked at a range of services across the care settings and all the different licensures that care navigators can deliver to individuals. And here we showcase some of the tasks in the telephonic, the home and community-based and clinical settings of care. The reliance on clinically licensed roles to help manage medications, comorbid conditions, and behavioral symptoms varies by individual and may increase as one's dementia progresses. But across these settings of care, we see that effective dementia care navigators can provide a mix of ongoing disease education, healthcare system guidance, counseling, behavioral symptom management, and referrals to community-based supports. Sorry for that busy slide, but it's in our report. And then just quickly, just an overview how we organized a report at a glance, organized around 2 thematic buckets. The first involving developing a framework to embed and scale care navigation on dementia care teams, and the second being to expand the payment mechanisms in traditional fee-for-service Medicare, Medicaid Care Advantage to incentivize the adoption of care navigators. I'm not going to go through all these details, but I'm breaking out all the different recommendations. Care navigation, again, as that linchpin for achieving comprehensive dementia care. And then I'll point to the first bullet in terms of focusing recruitment efforts on the growing number of nurse practitioners, physician associates, and social workers. The Bureau of Labor Statistics projects nearly a 52% increase in the number of nurse practitioners, 32% increase in physician associates, PAs, and nearly an 18% increase in social workers. So as we try to look at leveraging the growth of these roles to deliver the dementia care navigation services on the interprofessional care teams. The report also offers examples of training curriculum, online resources, and different certifications that are available. These are just a few examples of tech solutions that can also help with care navigation. The Alliance isn't endorsing any one of these, but just showing how technology is being developed and delivered to address workforce shortages. And it's important to note that technology is not meant to replace the high-touch care that's delivered by our variety of care workers, but and that still is very essential, but really to reduce some of the more administrative types of tasks and improve communication throughout that interprofessional care team. And then turning now to theme 2, sort of, and I'll go through these quickly, our recommendation, really supporting a lot of the work that the Alzheimer's Association has driven in support of the Comprehensive Care for Alzheimer's Act legislation to request that the CMMI deliver value-based comprehensive dementia care and an alternative payment model for that. And then while this legislation is also underway, there are existing levers within fee-for-service Medicare that clinical practices can draw on to deliver dementia care navigation services. There's the chronic care management, CCM, and the principal care management, PCM. Both all CPT codes that can be used to reimburse primary care providers and specialists who deliver these care plans. And then lastly, we just highlight the opportunity for Medicare Advantage plans to offer more flexibility in providing and paying for navigation services via the special supplemental benefits and special needs plans, the DSNPs. And Andrew, I really appreciate he listed a number of state initiatives that are addressing the dementia care workforce. And I'm just going to share a few examples, particularly what's happening in the state of California, since we worked really closely with them over almost the last year. They've had a decade-long commitment to improving dementia care in the state, and now a decade ahead, which included their master plan for aging. They also had a separate governor's task force run by former First Lady Maria Shriver on the path forward, an Alzheimer's prevention and preparedness plan. And they also, as Andrew also pointed out, how dementia really touches across all the different state agencies. The state of California has a cabinet level secretary and Governor Newsom staff responsible and overseeing the work on Alzheimer's prevention and preparedness, and a dashboard that's really looking at the initiatives. And then I'm just going to quickly go through some examples that they did because of some of the work we did with them. They're looking to scale comprehensive dementia care in California and been working with our alliance. This is a report we issued in March on implementing California's big and bold ideas on Alzheimer's disease and dementia. And so particularly looking to create a model, a standard of care for the nation. Again, I'm showing you those 8 core elements of comprehensive dementia care. And so this project was done in kind of in parallel with the work we were doing on the care navigation report, and looking at this care coordinator role, dementia care navigation role. So real quickly, Andrew also pointed out how dementia is underdiagnosed. So the state awarded $23 million to develop a statewide multi-site program that aims to improve the lives of people living with dementia and those that support them. So they're offering training to Medi-Cal providers in providing them the opportunity to bill for the cognitive health assessment for any adults 65 and older who are Medicaid only. They have a plan to disseminate training and to support primary care providers who implement that cognitive health assessment. And there's training, on-demand training, and they're offering CME, CEU, and MOC credits on comprehensive or cognitive health assessments. And they define that as taking the patient's history, using tools to assess the cognition and functional decline, and establishing and documenting a patient support person or healthcare agent, monthly webinars and online training. So this is a real commitment for the state to really look at improving detection and diagnosis of dementia. The state is also, again, looking at settings of care, and I mentioned adult day services earlier, a $23 million award from the State Department of Healthcare Services, a statewide multi-site program, and CalCompass. I'm sorry, this one is this is the adult day services, 7 sites, including an evaluation contractor. And they've offered community-based dementia-specific models designed to develop best practices to prevent or delay the institutionalization of people living with dementia, and supporting their caregivers and advancing health equity. So 7 different adult day services, and again, including the training for the workforce. And then another one I wanted to highlight, California Grows. This is their initiative to really enhance the training for the direct care workforce. So offering stipends, incentives, funding career pathways, and a $55 million Innovation Fund grant. This is not just for dementia care, but I just pulled out a few of the awardees who are focused on dementia. So a multilingual family caregiver dementia training program, a responsive one to support family caregivers again in dementia care, dementia and end of life, and then training for promotores. Lastly, you're probably familiar with the Healthy Brain Initiative. This is the roadmap that's developed in partnership with the with CDC and the Alzheimer's Association. So this was one that was done for 2018 to 2023, and the new one is coming soon. So all the information to really look at how do you support state and local public health agencies to address dementia. And then just a shout out to our Alliance Steering Committee who this provides us the support for the work we do with the Alliance. And that's it.
Great, Diane, thank you so much. And thanks again to Andrew. And we want to open up to questions and discussion here. You can certainly type your question into the chat or raise your hand and wait for us to call on you and unmute you to ask your question. I'll have my colleagues Asia and Trey to keep an eye out for Cody and to help me keep an eye out for questions. And perhaps Diane and Andrew can also keep an eye in there if something is mentioned that requires addressing specifically. While we're waiting for any questions to come in, I wanted to ask about, Diane, you mentioned the California's master plan for aging and the Healthy Brain Initiative. Andrew, you talked about the state Alzheimer's plans. There seem to be a lot of these sort of overarching projects going on. I'm wondering how well do they play together, and do they cover some of the same ground? Are these the same partners working together, or is it different levels of folks being engaged? And how does, with the particularly with the master plans on aging, the other ones, how does Alzheimer's factor into the other state master plans on aging that we're seeing around the country?
Diane, do you want to start?
So I'm most familiar with the master plan for California just because we did the deep dive, and my understanding is that other, so it's obviously broad, aging all, and of course, as Governor Newsom said, we can't talk about aging without focusing on Alzheimer's. And so my understanding is all the master plans do include Alzheimer's. In the state of California, they happen to do an even deeper dive to come up with a 10-point plan that was, bold and really helping to create the funding in order to support those goals.
Yeah, I would echo that. The master plans, we've definitely seen an uptake in recent years, right? States across the country are looking at bills or executive action towards establishing these. And California, I think, was the first. We also, though, have this is building on, I should say, a federal requirement that every state have a state plan on aging as part of a federal Older Americans Act grant that every state receives. And that is more prescriptive, looking at the specific programs that the federal government, a division within Health and Human Services, is supporting. But you're right, Sean, that dementia needs to be considered in all of these. And there are many different plans, I think, because there's a greater recognition of the impacts of aging population and what that means for the health and long-term care system. For this discussion, for example, we're supportive of an Alzheimer's state plan, and within California's master plan, they really had a significant focus on Alzheimer's, as Diane mentioned. But because it has such unique needs of this constituency and really does require a statewide approach, it is not just an aging issue, for example, but it does touch public health, it does touch law enforcement, does touch
Right.
workforce, that all needs to be considered.
Right. I do also want to add that grant makers in aging, my understanding is they are helping to fund these and also they've renamed it, instead of master plans on aging, they're being called multi-sector plans for aging. And they create these cohorts. I think it's groups of 10 states that go through kind of a learning network process. California, New York are exemplary states that have led in this area. And then particularly in dementia care, I know Georgia and Wisconsin are also leaders in this space. And so there's a learning network that happens. And again, you know, as Andrew said too, it's broader, it's aging writ large, you know, but dementia care, given how large it is, particularly the state Medicaid budgets, obviously a focus.
We had a question in the chat here from Peggy Welch, and she's asking about how direct care workers are engaged as part of the support team.
So I'll handle that. It's an area actually we feel like is underutilized. We think direct care workers, if you think about who's the communities who are disproportionately at risk for dementia, these are the care workers who tend to come from those communities. The Alliance did a literature review for the Institute for Healthcare Improvement last summer. And one of our key learnings through that review is that community health workers, you know, are a terrific resource who need to be trained in dementia care and can really help with early detection and screening, to then refer them into a primary care for evaluation and for really addressing some of the stigma with different communities around dementia. But we think it's underutilized and a big opportunity.
Great. We had another question in the chat from Senator Moriwaki from Hawaii, and she's asking, she says, we face a workforce shortage in all direct healthcare areas, from acute to long-term care facilities, and in home and community-based services. There's a need for navigators, but how do we recruit and retain them? What compensation, what incentives can they provide when they're short on providers to to refer clients and patients, and any recommended best practices either from California or other jurisdictions?
I'm sort of trying to read that one. Hold on.
While you're doing that, Diane, I can start here and just acknowledge, first of all, that it's very, very, very challenging when, you know, we're seeing, especially, you know, since COVID, that other sectors that previously were in line, you know, on wages, for example, are able to provide higher wages now, right? So direct care work, which this group knows is very, very physically demanding, emotionally challenging, and still, you know, relatively low paid. So it is challenging. You know, there's no one solution here, right? It's kind of a what works for your state, just try a bunch of things in many cases. I'm particularly very excited about the, you know, what Washington State's doing about career pathways, because if there's an opportunity to grow in that career, to actually, you know, increase that wage and potentially into the work is really positive. At the same time, we also know that retention is so low, turnover, you know, we're seeing, you know, in many cases less than a year, in some places much less than that. So lots of different things have to be considered here. Reimbursement rates certainly are part of it. A number of states have looked at wage pass-throughs, for example, but broader than that, right? What is the appeal of this work? Getting back to that, and how can people recognize that this is a great entry point into the healthcare workforce?
Yeah, and I think I would just add, because, you know, I mentioned the CalGROWS initiative really focused on the direct care workforce and creating the career pathways, the incentives. So a smattering of pilots and grants to do just that. But as Andrew said, as he started, it's really hard. It's very, very hard. And until we pay the direct care workers for the valuable work that they do and make this a career opportunity with, you know, a career ladder, is we're going to continue to have these challenges.
Okay. One thing also that I've seen is very, very exciting, because we know that dementia care costs more, right, than other long-term care and it's, again, even more demanding on the care staff, that some states over the past many, many years have looked at their reimbursement rate structure to say, can we recognize a higher cost of care, right? Can we say there's a dementia add-on rate, for example, which could then theoretically filter down towards the direct care worker individually towards elevating that wage, especially if, they're working in the memory care unit. As I mentioned earlier, some states have higher training standards for those units, providing, a boost if you're able to, meet those qualifications.
And Diane, I just wanted to follow up on that. So the folks in those care navigator roles, is that, is that sort of profession competing with, for that same pool of individuals who are, potentially up for these other jobs within the long-term care space, and is that a more appealing career just because of the differences in what they do?
Not necessarily. I mean, when you think about care navigation, it runs all the way from, you could have some of your community health workers, but they're managed by, a licensed professional. So you could have a social worker managing unlicensed folks, but who have had the dementia care training to really broaden and do reach, whether telephonically, there's the care ecosystem out of the UCSF, University of California, San Francisco, that has that as a model. But then you can have the care navigator being a licensed professional who's a social worker, who's a physician associate, who's an advanced practice nurse, obviously all different levels of certification, but there are shortages across the board for all of these roles. What we look at is there are opportunities for task shifting so that some of the things like a dementia screening, a brain health screening, we call them only cognitive assessments when they're actually done in a clinical setting. Think of a brain health screening that could be done. And there's lots of interesting tools that are out there now that are digitally based, that could be done, either on your phone or in an, at an audiology office. So there's a lot there in terms of the need, and it's not a one size fits all answer or solution, unfortunately.
We had another question in the chat from Dan Heimowitz, who's asking about has there been discussion about making healthcare easier for providers when dealing with dementia, documentation and billing issues that are time consuming and complicated?
So I'll answer it. We have one of the focus areas, the third focus area that we have is the comprehensive dementia care models. There are 6 evidence-based models, those 8 core elements, and there's a lot of activity going, again, led by the Alzheimer's Association, on really having an alternative payment model, the documentation, the billing, having the billing codes, all of that, having actually a cost per month per beneficiary, right? Andrew, you probably should be the one answering this. But that's an alternative payment model that really is needed because, as you point out, it's complicated and time consuming, the current method.
Yeah, this is a really hard nut to crack. Care coordination is really key, as I mentioned, and that's part of, I think, a central tenet of any of these new alternative payment models and dementia care models that are being discussed. And it's not, limited to dementia, right? This is an issue that crosses across healthcare. But I agree with you. It's a challenge, and really does need some more attention. I have not seen any efforts at the state level, though, in other states across the country towards addressing that specifically.
So this another question from Senator Moriwaki in Hawaii, and she's asking: Is there a pathway for billing Medicare and Medicaid for reimbursement for navigators? It appears to have additional category or code as the type of skill set to know how to assess and the services to coordinate for the individual client.
Right. So in terms of the billing pathway, we do need that alternative payment model. The alternative payment model, which is part of the Comprehensive Alzheimer's Act, includes a care navigator and then the reimbursement for that. And then I mentioned a couple codes already available, the PCM and chronic care management and principal care management that are available today in traditional fee-for-service. There are complications with that, which I didn't want to go into a ton of detail, but some of the requirements is it's 24/7. It requires 24/7 care. There's no clarification on we need clarification on the term, clinical providers. We want to see social workers covered for that specifically. And the other challenges is the 20% copay for that. So it's not ideal, but we do know that it's being used for covering the care navigator. It's just not ideal.
Great. Additional questions for folks? Let's see. So
I'll just add too for the Medicaid payments. We are looking at the dual special needs plans, the DSNPs, as a way to be able to help pay for that care navigator.
And also, I think as some states are moving towards managed long-term service and supports, that's the care coordination piece is a focus for those for the states and for the individual MCOs.
great. Well, unless there are any additional questions for these folks, we want to thank our guests today, Diane Tai and Andrew Ross. And a couple of quick notes before we go. Our next meeting of the network, which we expect to be in late June, will focus on the long-term care workforce policy concerns of AMDA, the Society for Post-Acute and Long-Term Care Medicine. Their members are the folks who serve as medical directors, physicians, nurse practitioners, physician assistants, and other practitioners in various post-acute and long-term care settings. I am meeting with folks from that organization later this week to talk about the focus of the session, possible speakers, and about scheduling a date and time. We will send around a Zoom registration link soon, and we hope that you will all be able to join us. We're also deep into planning network meetings throughout the rest of the summer, and we thank everyone who has reached out to suggest topics. We are working to develop our National Online Resource Center, as I mentioned at the top, which will be at that URL on your screen. If you want to go ahead and bookmark it, there's nothing there quite yet, but please send us your relevant bills, reports, resources, articles, and initiatives for us to include on the website about what is going on in your states regarding the long-term care workforce. If you would like to request technical assistance services or tell us what you'd like to hear about at future meetings, please don't hesitate to reach out with your thoughts. Thanks so much again for joining us today and participating in our discussion. We will talk again soon. So long.